So this coming week is critical. We need to know what the average number of cases is going to be. Why? Because we want to know what the community transmission levels are. Because we want to use that to guide us on what next steps we should follow and how we should manage the lockdown. So by the 18th of April, we will know if community transmission and whether our interpretation that community transmission has been kept low, whether that's accurate. And if we look at the 67 cases per day on average, the 95% confidence interval is 45 to 89. In other words, the true number of cases is between 45 and 89. So we have 95% confidence that the number of cases per day, even though we're seeing 67, there's some variability, and that variability lies between 45 and 89. So using that as an objective criterion, now we have an objective way based on the R0. In other words, how many people is an infected person spreading it to? If we base it on that, then we have a set of criteria. If the average number of daily cases, and we have to exclude active screening because that's not comparing apples and apples, but if we look at just the passive cases between the 10th and the 16th of April, and if we see 90 or more cases on average between the 10th and 16th of April, then we need to continue the lockdown. And the reason, put very simply, is that the average number of cases per day is going up. So the R0 is going above 1. And we don't want that. We want to keep R0 at 1 or lower. If we're seeing a number of cases between 45 and 89, then we are in the same region as 67, right, within the margin of error. And there we want to use our community prevalence. What is the active case finding telling us? And if that active case finding has a screening to positivity to screening ratio that is above 1 in 1,000, then we continue the lockdown. If it's below 1 in 1,000, then we can ease the lockdown. Similarly, if the absolute number of cases is 44 or lower, we can ease the lockdown because it tells us R0 is less than 1. So you can see that using epidemiological criteria, we create a set of a clear approach as to how to deal with the lockdown. Now you must expect that there'll be large daily variations, right? Because just the way the timing of the lab tests and so on. So you will see that, and you will see some large numbers, some small numbers. Don't let that bother you. You have to look at it over a period of time. And so that's why we look at a whole week at a time, and we compare weeks with weeks so that we're comparing apples with apples. We know that if we end the lockdown and we end it abruptly, we may run the risk of undoing all of the effort and the benefit we've achieved. Because then we'll be putting high risk and low risk people together, traveling in the same buses, taxis, trains. We have to do something about that. We have to avoid that situation. And so we need to think about and plan for a systematic easing of the lockdown, starting with transport hubs and then working our way down from the lowest risk to the highest risk.